Today we're going to be going over your discharge instruction packet for the upcoming hip replacement surgery. I will be going through the entire packet with you today. I will also be sending in prescriptions for you, and we will discuss the postoperative physical therapy protocols, as well as a lot of the common do's and don'ts and issues and bumps in the road that people encounter after surgery. So in this packet, this does have everything in it. This is functionally the Bible to follow for the next couple of months. The first page is making sure that we have done everything in preparation for surgery. The first one is that you should have seen your primary care physician as well as any other specialist, such as a cardiologist or pulmonologist, in preparation for the surgery. We will need the notes from them saying that you are in prime condition to go forward with the surgery. You should have already had your blood work done, which I will have reviewed. Part of that is the nasal swab, which will tell me what kind of bacteria normally grows on your body. And there I'm looking for anything that could possibly be resistant. So that way during surgery, when I give you your antibiotics in the operating room, I give you the proper type to match whatever grows on you. We're going to be going through your own medications and determining when to stop certain types of medications and when it is safe to restart them. There are some blanket categories that we need to stop a week before surgery. All vitamins, minerals, natural supplements need to be stopped a week before surgery. Also, all anti-inflammatory medications such as Advil, Aleve, ibuprofen, naproxen needs to be stopped a week before surgery. If you take a baby aspirin, an 81 milligram aspirin, that is safe to keep taking the entire time. If you take Celebrex, that is still safe to take before surgery because that does not impact any risk of bleeding, at least for my type of surgery. The next page in the packet discusses the bandage. This is very simple. It is waterproof. It stays on for 2 weeks. Nobody touches it but me. Just don't scrub at it or peck at it. It will be fine. The next page starts to discuss medications that I'm going to prescribe for you today. The first one is the blood thinner. This is there to make sure that you do not get a blood clot after surgery, which could go to your heart or to your lungs. You will take this blood thinner every day for a month after surgery. You will start up the evening after you get home. Depending on what it is, determines whether you have to take it every 12 hours or every 24 hours. This will be determined based on your insurance as to what gets approved and also what variety will best suit your medical conditions. The next talks about pain management, and this goes in different steps. The first step is very simple. Tylenol, which you can take up to 3,000 milligrams in a 24-hour time frame. Little doses throughout the day to kind of stay ahead of the pain a little bit. Also icing, and getting up and moving around actually helps to loosen up the hip so it doesn't get so stiff and painful. As it turns out, that's also part of your physical therapy. I want you up and walking or doing something with the leg 10 minutes every hour during the daylight hours. That will also help to promote blood flow and prevent a blood clot, as well as stimulate more healing of the bone and the muscles and reduce some of that pain due to stiffness. Now, the next step up in pain management is anti-inflammatory medications. We have several options here. I will send in prescriptions for these. You will take them twice a day. You take the prescription until it's gone. It will be circled in your handout which one you should be taking. Now, the next step is a muscle relaxer. Not everybody needs this, but some people do get either spasms or really tight muscles after surgery. This is because I do stretch the muscles a lot to get into the hip. I don't cut so much in the way of muscle anymore, but they do get stretched. And so you will really feel it, especially in your gluteal muscles and in your thigh muscles. If it's more in the musculature, I recommend trying the muscle relaxer first. That frequently helps people out enough where they do not need anything stronger. Now that does bring up the final step, which is the narcotic. Typically I give Vicodin. Most people need, on average, about 10 or 12 tablets of Vicodin in their postoperative phase after a hip replacement. I will give you slightly more than this in order to make sure that you have enough. If you do have any extra left over, I recommend disposing of them at the police station in the medication drop box that they have. Narcotics, we know, are bad for you. They cause constipation, they will make you sick to your stomach, they mess with your head, they're addictive. As it turns out, they also reduce your immune function and can increase your risk of infection and also increase the risk of scar tissue formation. So for the most part, you want to minimize these as much as you can. Breaking the tablets in half and spreading it out that way can help out. To help out with some of the side effects of the narcotics, I will give you a prescription for an anti-nausea medication, Zofran, which is a dissolving pill you put under your tongue as needed if you do get sick to your stomach. The other one is for constipation. A stool softener is very important to be taking, and very likely you will need some actual laxatives to push things through to help prevent the constipation or to manage it when it does happen. It is universal. Almost everybody gets constipated, so I recommend that you stay on top of things. The last thing that you want to be is a week out from surgery and no bowel movement. That's when you have to go to the emergency department, and nobody wants that. The next few pages start to talk about physical therapy. And like I said, this focuses really on walking, on moving around, and getting you going and back to normal life. You will have a physical therapist working with you at home for the first couple of weeks. You'll start off using a walker. We have walkers both at the office and at the surgery center that we can give you. When you are done with the walker, most people transition to using a cane. You stick with the cane for up to about 3 or 4 weeks after surgery. Once I know that your balance has returned and all the bad habits are worked out of your system that were there from when you had the arthritis. The most important thing is that we want to avoid any risk of falls or injury to you. Safety is number one. So if it means you have to use the walker for an extra couple of days, that's okay. I'd much rather be safe than to push things too fast and risk a fall. There are certain movements that you're not allowed to do with your hip. This is to make sure that those muscles that I stretched actually heal nicely for you. So you're not allowed to bend past a 90-degree angle from your thigh to your torso. You're not allowed to twist the leg, and you're not allowed to cross your legs. All of this is outlined in the handout. There are also some basic muscle exercises that you can do to help get things moving, both when you're laying down, sitting, or standing. I do have several pages in here for the caregiver. This goes through a lot of the common things that are going to happen to you after surgery. Number one is swelling. It happens to everybody. It's going to be there for about 3 months. It's just gravity pulling the fluid down the leg into the foot. If it gets really bad, you lay down, you elevate your leg, you put some ice on, you do your ankle pumps. That will also help to get rid of the fluid. Eventually, it will just stop happening and you won't have any more swelling. The other thing that happens to everybody is bruising. Up and down the leg, very common. Some people get a tremendous amount of bruising, and that's okay. That is normal. Other common issues, dehydration. And what that leads to is dizziness when you sit up, or if it gets really bad, you can pass out. When people pass out, it can be quite frightening for people that are witnessing it. This does happen when you get dehydrated, or if you've taken too much of the narcotic, or if you've just pushed yourself too much and spent too much time upright right after surgery. So it is very important to go slow, take it easy in the beginning, and be wary of the narcotics and drink lots of fluids. There are other common issues that are encountered here. I do have them all detailed. Also, my cell phone is in here. I ask people that if they need to reach me, they can send a text. Daylight hours preferable, just so that way you're not waking up my entire household in the middle of the night. Also, we have the emergency line is available 24/7. All you have to do is call the office line and they will get through to you. What I tell everybody about this surgery is that this is like a roller coaster. When you are walking around the amusement park, you'll look at people getting on the roller coaster, they're screaming, laughing, having a great time. You say, oh, that looks nice. That looks like they really had a great time with that, because everybody's smiling when they get off of it. If you get on the line, then the anxiety starts to pick up, the heart rate starts to get going. The closer you get to getting on the ride, the more things are going up. You get really anxious right as you're getting on it. That's exactly what it's like as we're approaching that day for surgery. The anxiety goes up, the heart rate goes up, the blood pressure goes up, all normal. You get through the ride, and then at the end of it, you're like, oh, that was great. My hip feels wonderful. I'm glad I did it. But it takes a long time. It takes 3 or 4 months to fully recover from the surgery. Oddly enough, if we have to do another surgery on you, it starts all over again. You get back in that line, you are just as anxious a second time around, even though you know it will turn out well at the end of the day. So the anxiety is normal. And it is a rough trip, especially that first week after surgery. You do have a lot of pain, a lot of immobility. You have to do little steps, little bits every day, little bits every hour to get through this. And as long as you do that slow and steady, you will end up doing really well. There will be good days, there will be bad days. That's normal. You just have to keep plugging away at it. I'm really looking forward to seeing you before surgery. We will get through this together. You will have a good outcome. It will take time, but you will be pleased with the results. You will be much better off than where you are today with the arthritic hip. In the meantime, you will be seeing Austin, my PA. He will be working with you. He will also be working with me on the day of surgery. After surgery, you will be seeing both of us at different points in time. I will next see you in the office 2 weeks after surgery, and we'll get the bandage off then.